Welcome to The Explainer. Today, we're taking a journey deep inside one of the most common and honestly one of the most misunderstood conditions out there. We're going to demystify heart failure piece by piece.
So, let's just jump right in with the biggest question. When you hear those two words, heart failure, what do you picture? For a lot of people, it sounds terrifying, right? Like a sudden final event. But is that what's really going on? Let's clear that up right now.
You know, the term itself is actually a bit misleading. Heart failure doesn't mean your heart has failed or just stopped working. Think of it more like a pump that's lost some of its power. It's a chronic condition where the heart muscle has gotten weaker and just can't push blood around the body as well as it used to. So it's not a sudden stop, it's more of a gradual slowdown.
And this is not some rare disease. We're talking about a huge number of people. In the United States alone, it's estimated that 6.5 million adults are living with heart failure. That is a massive number of lives affected by this every single day.
And with that personal toll comes an enormous cost to society. Get this, over $30 billion every single year in the US alone. And that number includes everything: doctor's visits, hospital stays, all the medications, and even the time people miss from work because they're just not well enough. It's staggering.
Okay, so we've established it's a problem with the pump. But, a problem can mean a couple of different things. It turns out there are really two main ways the heart's mechanics can go wrong.
The easiest way to think about it is this. It's either a weak pump problem or a stiff pump problem. With a weak pump, what doctors call systolic failure, the heart's main chamber just isn't strong enough to squeeze hard and push blood out. But with a stiff pump, or diastolic failure, the muscle is plenty strong, but it's become stiff, so it can't relax to fill up with blood in the first place. Two different problems, but they both lead to the same result. Your body isn't getting the blood it needs.
So how do doctors measure how well that pump is working? Well, you'll probably hear them talk about something called the ejection fraction, or just EF. It's basically a percentage that tells you how much blood gets pumped out with every single heartbeat. A healthy heart is going to be at 50% or higher. This number is absolutely crucial for doctors to figure out the best way to treat it.
All right, so that's the science. But what does heart failure actually feel like? Let's talk about the human side of this, what a person actually experiences day to day.
One of the first and scariest symptoms is feeling short of breath. Think about it. If the heart can't pump blood forward, it creates a traffic jam. The blood backs up, and where does it back up to? The lungs. That fluid in the lungs makes it feel like you're drowning, like you just can't get a deep breath, especially when you try to lie down.
And then there's the fatigue. And I'm not talking about just feeling a little tired. This is a deep, bone-crushing exhaustion. Your body's organs and muscles are literally being starved of the oxygen-rich blood they need to function. So of course, simple things like walking up the stairs can feel like climbing a mountain.
You also get swelling. As the heart pump gets weaker, the kidneys get confused. They think the body is dehydrated, so they start holding on to all the salt and water they can. All that extra fluid has to go somewhere, right? It ends up in the legs, ankles, and even the belly, causing swelling and sometimes a really sudden gain in weight on the scale.
And take a look at this, because this image shows you exactly what's happening inside the body. This is a chest x-ray. See how big that heart silhouette is? It's enlarged. And all that hazy, cloudy stuff at the bottom of the lungs, that's the fluid backup we were just talking about. That's the physical evidence behind that awful feeling of being short of breath.
Okay, now for the most important part. After hearing all that, you might feel a little discouraged, but here's the good news. A heart failure diagnosis is serious. Yes, but we have an incredible toolkit to fight back. This is absolutely a condition you can manage. So here's the game plan.
The treatment plan is like a fortress with multiple layers of defense. It all starts with the foundation, and that foundation is lifestyle. Then, on top of that, we add a powerful pharmacy of medications. And for people who need more, we have some amazing high-tech devices and surgical options.
And listen, this first layer is where the patient becomes the MVP of the treatment team. It's all about taking an active role. Things like weighing yourself every day to catch that fluid buildup early, slashing the salt in your diet, and of course, getting the right kind of physical activity to keep your body and heart as strong as possible.
On top of that lifestyle foundation, we bring in the medications, and the science here has exploded. Today's gold standard is built on what cardiologists call the 4 pillars of therapy. Each one of these drug classes tackles the problem from a totally different angle. Some slow the heart down to let it rest, others help the kidneys get rid of extra fluid, and others relax blood vessels to make the heart's job easier. Using them together is a game changer.
And when that's still not enough, we move on to some truly incredible technology. An ICD, for example, is like having a tiny paramedic living in your chest, watching for dangerous heart rhythms and shocking the heart back to normal if needed. A VAD is literally a mechanical booster pump that helps your own heart do its job. And for the most severe cases, a heart transplant is still the ultimate fix.
So that's the toolkit for today. But what does the future hold? Well, the journey doesn't stop here. The way we treat heart failure is getting smarter, more predictive, and way more personalized. And it's all thanks to a revolution in technology.
I love this quote from Dr. Michelle Kittleson, a cardiologist. It perfectly captures this huge shift that's happening. For so long, a lot of medicine was an art, based on a doctor's experience and intuition. But now, we're moving toward a future that's driven by hard data, by pure science.
And a huge driver of that new science is artificial intelligence. AI can do things that are just impossible for the human brain. It can look at millions of patient records, millions of heart rhythm strips, and spot these incredibly subtle patterns. And by doing that, it's helping us predict who is at high risk for heart failure long before they ever have a single symptom. It's a total game changer.
Which brings us to this final, really exciting question. Are we on the edge of a new era? An era where, thanks to tools like AI, we can finally get ahead of heart failure. A future where we can predict it, prevent it, and turn this chronic condition into something that's just manageable. It's a hopeful thought, and the journey to get there is happening right now.